Welcome to Your Heart in the Best Hands. I'm Beatrice Canals at Mount Sinai Medical Center on Miami Beach, Florida's leading heart hospital. Founded in 1949 by a group of visionary individuals who sought to establish a hospital where doctors could practice and patients could receive care without discrimination. Mount Sinai has grown from a small community hospital to a world-class academic medical center with multiple locations throughout Miami-Dade. At the core of Mount Sinai's mission is a commitment to serve our community and provide outstanding medical care with proven results. The Mount Sinai Heart Institute, in affiliation with New York's Ivy League Columbia University, offers patients the best heart attack survival rate in all of Florida and the highest level of accreditation awarded by the Society of Chest Pain Centers. Plus, Mount Sinai is the only U.S. News and World Report high-performing heart hospital in Miami-Dade County, which is why when well-known Aventura pediatrician Dr. Raciel Socaras began having chest pain, he knew exactly where he wanted to be treated.
I was working out my usual morning workout with my trainer, and we do interval training. And in between one of the sets, I started feeling this crushing chest pain I've never felt before. I immediately thought, well, maybe it's muscular, it's going to go away, and it really didn't.
My husband is a triathlete. He works out every single day of his life. He's probably the healthiest guy I know. And around 7 o'clock in the morning, I get a phone call from my husband, and he says, I just cleared my schedule at work. I'm not feeling well. I'm having chest pains. The first thing I thought about when he told me he was having chest pains was obviously that he could be having a heart attack.
Dr. Socaras is a relatively healthy person. He was working out at the gym, and he started having this chest discomfort. And it was uncomfortable enough that he came to the emergency room here. He was rapidly triaged to our chest pain unit. EKG was performed, which showed that he was in fact having a heart attack involving possibly the right side of his heart. And he was rapidly rushed to the cath lab.
When they really came to me and told me, you're having a heart attack, and I looked at my wife and I looked at myself, and it sort of hit me. I go, I'm having a heart attack. This is unbelievable.
I've never seen my husband like that ever. He was really, really scared I think for the first time in his life.
Once we found that the artery was closed 100%, we put what's called a coronary guide wire to gain access to the artery. And then we put a balloon to open it up. And then we put a stent, which is like a little metal tube that keeps the artery open.
Wheeling me into the cath lab, they had given me some medications, 10 people, they're all doing their jobs, doctors giving orders, and everything's happening so quickly, and within, say, 5–10 minutes, I was actually looking at the screen, and I saw as the blood started to flow back into my heart, the pain just immediately went away.
The doctor came out, and he said my husband was stable, that he was in good condition, and that, thank God, that there was no damage to his heart.
1 in 10 of these patients will die if nothing is done. And in fact, 50% of them would die within the first hour of having a heart attack. Being able to get in there and open the arteries and save their lives is very gratifying.
I most recently had a stress test done, a nuclear stress test, and everything came out excellent. I have normal cardiac function, and I hope to continue and start doing my exercise and my triathlons and all those things.
I believe 100% that Mount Sinai gave my husband his life. I am so grateful.
We're very happy that we went to Mount Sinai. We're very happy how everything turned out. I'm blessed to have a beautiful wife and a wonderful daughter, and I thank God every day.
Every year, an estimated 1.2 million Americans suffer a heart attack. Most heart attacks start slowly with mild pain or discomfort. Oftentimes, people aren't even sure what's happening. Warning signs include chest discomfort, often in the center of the chest, that lasts more than a few minutes or that goes away and comes back. It can feel like comfortable pressure, squeezing, fullness, or pain. Discomfort in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath with or without chest discomfort. Other signs may include breaking out in a cold sweat, nausea, or lightheadedness. If you suspect someone is having a heart attack, the American Heart Association encourages you to call 911 immediately. In addition to providing outstanding heart attack care, the Mount Sinai Heart Institute is home to Florida's most active valve program and the best cardiac surgical outcomes in the state among hospitals performing the highest volume of cases. The Mount Sinai Heart Institute offers the least invasive valve repair and replacement options available. 31-year-old William Myers recently underwent heart valve surgery at Mount Sinai. The soon-to-be police officer discovered his valve was not working properly during a routine police examination.
Well, I first found out about my heart issue after I graduated from the police academy. I went to an employment physical, and they found it on EKG, and they wouldn't clear me to go into work. I went through the entire academy. It was very strenuous. It was waking up at 5 o'clock in the morning to go run 5-6 miles to do hundreds of push-ups. I made it through it fine. I was at the top of my class. I was in great shape as far as that. I never thought anything was wrong.
Mr. Myers is a young gentleman who had a significantly leaking aortic valve, and he needed the operation in order to be able to pursue his career, which is in the police department. And obviously we all know that's a very physical job at times and very demanding.
I learned that Dr. Lamelas had the best survival rate, and that Dr. Lamelas was probably the best in the nation to do the surgery. And with that said, I couldn't imagine going to anybody else.
And I performed a minimally invasive aortic valve replacement. So we do this through a 5 to 6 centimeter incision, which is usually less than 2 inches on the right side of the chest for the aortics and also for the mitral valves. And we work through a very limited access, and through that we're able to perform the entire operation.
I couldn't imagine going anywhere else but Mount Sinai for this surgery. Everybody's been great, from the nurses to the technicians to anybody that I interacted with. They were great.
Well, in coming to Mount Sinai, the patient's going to get the operation that they need, not the operation that's limited to the group of surgeons or that the hospital provides. Here at Mount Sinai, we have a tremendous amount of experience in cardiac surgery. In fact, we're one of the highest volume hospitals in South Florida, and also one of the highest volume hospitals in the state of Florida. We also perform the most valve operations, I would say, in the state of Florida, with the highest survival rate in cardiac surgery.
I'm excited to be able to move on to the next step. I have the surgery behind me now, and everything went well. I'm looking forward definitely to moving on and getting on with my career. I couldn't have asked for a better group of people to take care of me.
I am inside Mount Sinai's new state-of-the-art hybrid room. It's a combination cardiac catheterization laboratory and operating room. This advanced suite features some of the most modern equipment available, enabling doctors to access hard-to-reach areas of the heart via tiny catheters, and all interventional and surgical procedures can be done in this one room. It is here that doctors at the Mount Sinai Heart Institute are conducting the CoreValve clinical research trial to determine the effectiveness of a new catheter-deployed, non-surgical valve procedure. Mount Sinai is one of only 40 sites throughout the country selected to participate in the Medtronic CoreValve clinical research trial. The CoreValve system is designed to provide a non-surgical treatment option for patients with symptomatic severe aortic stenosis. Worldwide, approximately 300,000 people have been diagnosed with this condition, 100,000 in the U.S., which occurs when the heart's aortic valve is narrowed, restricting blood flow from the heart to the body. Approximately 1/3 of these patients are deemed too high a risk for open heart surgery. If you would like to learn more about the CoreValve clinical trial, please call 305-674-2162. There's still much more to come when your heart in the best hands returns. We'll learn why hypertension can't be ignored, and why consulting an expert is vital to your well-being. Plus, what are your legs telling you? Peripheral artery disease, what you need to know. And what's your risk of developing heart disease? We'll tell you how to find out from the comfort of your home.
When it comes to neurology and neurosurgery, there's one hospital in South Florida that combines the most advanced equipment with a 24-hour comprehensive stroke center and a nationally recognized Alzheimer's research center, all backed by the most experienced specialists with proven results. But ultimately, it's all about one thing. Mount Sinai Medical Center. Experience better results.
Welcome back to Your Heart in the Best Hands. I'm Beatrice Canals at Mount Sinai Medical Center, home to the Mount Sinai Heart Institute, the most active cardiac program in South Florida. Cardiovascular disease, it's the #1 killer of both men and women in the United States. Risk factors include elevated cholesterol and other lipid levels, high blood pressure, diabetes, smoking, physical inactivity, poor diet, and being overweight or obese. Mount Sinai offers a free online health risk assessment. Simply log on to msmc.com to take the Mount Sinai Heart Health Profiler Survey. You'll be provided with your heart's age and your risk of developing cardiovascular disease. It only takes 5 minutes to complete, and the results could save your life. Hypertension is often referred to as the silent killer. Left untreated or mismanaged, the results can be devastating. Mount Sinai's Chief of Cardiology, Dr. Gervasio Lamas, explains why managing your blood pressure is so important and why second opinions are so valuable.
Hypertension in layman's terms is really high blood pressure. And what that really means is that the amount of pressure that the blood exerts against the walls of the artery is more than normal, or more than would be desirable for the blood vessels. So a normal, sort of rock normal blood pressure is 120 over 80. As people get older, their blood pressure rises. We used to think that that was normal. It's not quite normal, because the higher the pressure inside the arteries, the more damage is done to the walls of the artery. The walls thicken and they lose a lot of their normal function. The other thing that happens is that the heart has to pump harder against the pressure in order to get the blood out of the heart to perform its vital functions. The reason that hypertension or high blood pressure is called a silent killer is that it can kill you. It can cause a stroke, it can cause your kidneys to fail, and it can cause a heart attack. And it can do so without producing any symptoms until the very end. So most of my patients who have high blood pressure do not necessarily feel any symptoms that their pressure is high. Most people, when their blood pressure is high, they don't feel it. Some get headaches. The majority are completely fine, or so they think. And yet the damage is being done silently. So whenever you see a blood pressure machine in a drugstore or a supermarket, just sit at it, stick your arm in it, and measure your blood pressure. One of the strengths that we have at Mount Sinai is that we have a really devoted team and an expert team to treat patients with high blood pressure. And I can tell you, you can always get the blood pressure under control, and you can always get it under control in a way that the patient feels good, that they feel better than when they showed up. A patient has to be, to a certain extent, in charge of their health care. And there are many times when another opinion from an expert, as we have here at the Mount Sinai Heart Institute, can really get you on the right path. The most important part and the most difficult part of the second opinion is telling your own doctor, with whom you have a relationship, perhaps for many years, that you would like to get another opinion on your illness. That's tough. And many patients don't get control of their health care because they're afraid of saying that to their physician. And when a patient asks me if they can get a second opinion, I say, absolutely. And that's really what your doctor should be saying to you.
The Mount Sinai Heart Institute also offers expert care for the treatment of pulmonary hypertension. Pulmonary arterial hypertension is high blood pressure in the arteries of the lungs. These arteries carry blood from the heart to the lungs, where it picks up oxygen before being pumped to the rest of your body. Over time, pulmonary arteries can become narrow, which increases the pressure within the arteries and decreases blood flow from the heart to the lungs. The increased pressure can cause further injury to the arteries. That makes the heart pump harder and causes the walls on the right side of the heart to thicken and weaken. Many of the symptoms of pulmonary hypertension, such as shortness of breath or feeling tired and weak, are caused by arterial narrowing and increased stress on your heart. For more information on the Pulmonary Hypertension Program, visit msmc.com or call 305-674-2690. Mount Sinai is among a select few hospitals in the United States offering transradial percutaneous coronary intervention, or PCI, for the treatment of heart attacks and other conditions. Traditionally, interventional cardiologists reach the arteries of the heart through the femoral artery, located near the groin, when needing to open a blocked artery. The radial option allows interventionists to gain access through the wrist.
The advantage of the radial approach is the risk of bleeding is much lower, and also the risk of damaging any nerves is much lower. It's much more convenient for patients because they can literally walk out of the cath lab with a small wristband on their wrist.
A recent study published in the Journal of the American College of Cardiology suggests a decrease in mortality utilizing this approach, which is common in Canada and Europe, but not widely available in the U.S. If your legs have been hurting and the pain does not seem to go away, you could be suffering from PAD, or peripheral artery disease. It's a serious condition that could lead to amputation if left untreated. Mount Sinai is a leader in the treatment of PAD.
Peripheral arterial disease is a full spectrum of problems that patients present with. They can present with pain after walking a short distance, pain in the calves, pain in the thighs. It can be worse than that, to where you can have rest pain. Just laying around watching TV, you have rest pain in your legs. And then you can present with the way Mr. Ponce presented, with a little sore, a little ulcer, a little area of gangrene on his toe. And he also had associated infection with that. And that progresses very rapidly. And if we're not able to take care of that with improving circulation, he could lose his leg. We brought him into the cath lab, shot an angiogram, and were able to localize a blockage, which we were able to fix with a stent and improve the circulation. And he went on to almost complete healing of his wound. He had some little areas that had to be removed, but had an excellent result. Peripheral arterial disease is very common in the United States. Folks over the age of 65, 15 to 20% of those folks will have peripheral arterial disease, and it's quite telling as a predictor of other cardiovascular disease, such as strokes and coronary artery disease. If you have pains in your legs when you walk that is relieved by resting, that is classical symptoms for PAD. Mount Sinai is cutting edge as far as our new technology, as far as our commitment to research. These are cutting edge, state-of-the-art research projects that are trying all the newest modalities, all the newest devices for opening up blockages in the arteries.
Oh, I feel great, you know, I don't have pain, you know, I can walk, you know, perfectly, you know, I'm sleeping good, I'm feeling great.
It's just a labor of love for me to be able to see these folks walking down the hall, smiling, and not in pain any longer.
Millions of Americans suffer from heart rhythm disorders, conditions ranging from atrial fibrillation, tachycardia, to arrhythmia. The Mount Sinai Heart Institute offers the most innovative treatment options, including the hybrid maze procedure for AFib. Marlene Shedd is one of many patients who's been successfully treated at Mount Sinai for a heart rhythm condition.
It started with shortness of breath, erratic heartbeat, like a shot of adrenaline that just shot right through my body, and it jolted me.
There are many different types of heart rhythm disorders, and the heart rhythm can be either too slow, which we call bradycardia, or too fast, which is called tachycardia. The most common heart rhythm disorder that we see is a tachycardia called atrial fibrillation.
When I started having the arrhythmia, it just got worse. One day it was better, one day it was worse, and then it just escalated. And by Saturday, I was in the emergency room.
What people feel is the rapid rate and also the irregularity. Some of the common symptoms would include palpitations, heart racing, the sensation of an irregular heartbeat, but people could also feel chest discomfort, shortness of breath, and sometimes even lightheaded, dizzy, or pass out.
They did run a whole battery of tests, blood tests, and they all came back normal. And I was discharged with beta blockers and an aspirin regimen. I wasn't happy on the beta blockers nor the aspirin regimen. They didn't do enough. I still didn't feel 100% better. So I decided to get a second opinion, and I went over to Mount Sinai.
Initially, Marlene presented with palpitations, a rapid heartbeat, and lightheadedness.
With Dr. Jacobson and his team, they knew what they were talking about. They knew immediately how to treat it. I felt that I was in good hands.
For Marlene's procedure, she basically came in that morning, underwent the procedure, which is a minimally invasive procedure where we get electrode-tipped catheters into the heart. We were able to induce individual beats that we were able to track down and successfully ablate.
I knew immediately that I felt that it had worked because I felt better and because I heard the excitement in his voice and Dr. Jacobson's voice. Within a week, I was back to my normal activities. I was back to a normal life. He gave me back my life. To his team and Dr. Jacobson, you rock. They're great. I landed in the perfect hands.
Many people associate heart disease with older men, and while men are at risk, heart disease does not discriminate. Women are also impacted. In fact, 42 million women in the U.S. suffer from some form of heart disease, making cardiovascular disease the leading cause of death among women. Grace Palmer, who you are about to meet, was determined to find a resolution to her ongoing cardiac condition. It's why she turned to the expert cardiology team at Mount Sinai. Grace was not about to allow heart disease to keep her from spending time with her granddaughters.
The classic description of heart disease, chest pressure, is not always the presentation in women. In fact, more women present with atypical symptoms. It could be a discomfort in the shoulders, the arms, the neck, the jaw. It may just be shortness of breath or sweating.
My heart started beating so fast, I didn't know what it was. I went to the hospital and they told me I was suffering from arrhythmia.
In the case of Grace Palmer, she manifested her heart disease at an older age, had a family history of heart disease, and was having significant symptoms.
I went to Mount Sinai to get a second opinion because I wasn't very pleased with the results that I was having with my problem. The doctors at Mount Sinai, they showed me that they were taking the interest that nobody shown before.
She finally came here to Mount Sinai Medical Center for a second opinion. We were able to adjust her medications and even perform a procedure taking care of the arrhythmia, getting rid of the arrhythmia, and she's had no more symptoms since.
They did an outpatient procedure that no one did on me before. And after that procedure, I was a different person. Everything went fine. I can do things that I wasn't able to do before. I can play with my granddaughters. I take them shopping, I take them to the park, and I feel like a different person.
Women have to be aware that they're at risk for heart disease. In surveys, only 1 in 10 women even understand or recognize their risk for heart disease. In general, women perceive their greatest risk to be breast cancer, certainly an important disease, but on average, 1 in 27 women will die of breast cancer, whereas 1 in 2 women will die of heart disease.
There's nothing to fear this as long as you go to the right place, you go to the right doctors, and you have confidence. Thanks to Mount Sinai, I've been doing just great.
I love having my grandma around because she makes me be happy and she's just a nice person.
Now, according to the American Heart Association, every minute in the U.S., a woman dies from heart disease, stroke, or other forms of cardiovascular disease. More than 1 in 3 women is living with heart disease. Although heart disease death rates among men have declined steadily over the last 25 years, rates among women have fallen significantly less. The Mount Sinai Heart Institute's newest program is specially designed for adult patients with congenital heart diseases. The Congenital Heart Disease Program provides treatment for patients who were treated for heart-related birth defects during childhood and are now grown adults. This unique program combines the strengths of a nationally recognized pediatric cardiologist with the expertise of the Mount Sinai Heart Institute Adult Cardiology Team. Together, they provide coordinated diagnosis and treatments not available at other institutions for congenital heart disease patients. To learn more about the Adult Congenital Heart Disease Program, visit msmc.com or call 305-674-2690. The Mount Sinai Heart Institute offers the most comprehensive cardiac care available today, regardless of your cardiac needs. The expertly trained team here at Mount Sinai is ready to provide you with a comprehensive diagnosis and, if need be, treatment in a compassionate and family-centered environment. So you may be asking yourself, what sets Mount Sinai apart from other heart programs? Mount Sinai has brought together some of the best medical minds in cardiology. doctors who are true leaders in their field and offer unique options not available at other institutions. Mount Sinai is the only Florida hospital with an Ivy League affiliated cardiology program. Their academic affiliation with Columbia University in New York means you benefit from two proven leaders in cardiology. Mount Sinai offers the latest, least invasive, and most modern equipment, and their cardiology team is actively involved in life-saving research, which means patients benefit from the most up-to-date treatments available. Most importantly, the Mount Sinai Heart Institute offers patients proven results. This includes the best heart attack survival rate in Florida and the best cardiac surgical survival rate in the state among facilities that perform more than 750 cases a year. While we focused exclusively on cardiology today, Mount Sinai Medical Center offers outstanding medical services in a host of specialties, ranging from neuroscience, which includes stroke care, to urology, cancer, orthopedics, GI, and maternity, just to name a few. Mount Sinai also offers convenient locations throughout Miami-Dade, including a freestanding emergency room and imaging center in Aventura, and physician offices in Key Biscayne, Hialeah, and Aventura, plus a diagnostic cath lab and sleep study lab in Coral Gables, and the system's medical hub, the world-class Mount Sinai Medical Center located on Miami Beach. For more information on Mount Sinai Medical Center and the Mount Sinai Heart Institute, visit msmc.com or call 305-674-CARE. That's 305-674-2273. On behalf of the doctors, nurses, and staff at Mount Sinai Medical Center, I'm Beatrice Canals. Thank you for watching Your Heart in the Best Hands. Have a great day.